Hi, guys. It's Ken Frucci from Corporate Medical Emergency Training. Doing another one of your virtual online training courses that you have to have in your learning management system. And this video will hopefully be a little bit more interesting, per se, than the other videos that we've had to do for you with OSHA, because obviously that's some pretty dry stuff. And this actually is your opiate overdose awareness. Every state in the United States, with medical dental practices, where you have your offices through your employer and your DSO, both New York and New Jersey require this training for dental hygienists and also for dentists and the doctors, oral surgeons. And in New Jersey, the dental board is a little bit different than in the state of New York. Your New Jersey practices and offices have to have a minimum of 1 hour of continuing education credit in opiate overdose. And in New York State, the dental board there actually, and the medical boards, they actually require 3 hours of education and continuing education for opiate overdose. And I think that the 3 hours is a little bit much, because I think they kind of want people to go through the whole pharmacokinetics and chemistry and pharmacology, which I don't feel that's necessary, because as healthcare providers, myself, as you well know, I'm a retired New York City paramedic. I have a paramedic degree. I think it's too much information for people, and they don't need to know that. But the point of this is to make you aware of what the protocol should be and how to give emergency Narcan if we suspect a patient has any type of suspected overdose or any kind of a substance abuse. So we're gonna go through that, and we'll just touch base on the protocols and how we give the Narcan, certain things we need to know, certain things we need to know what to do after we've given the Narcan. So most of us know that with the opiate crisis that we've had in the United States, anybody can give Narcan now. Anybody can walk into a pharmacy and they can purchase Narcan without a prescription. It's typically not on the counters in the drugstore. It's typically behind the pharmacy window. When oral surgeons, dentists, or doctors are prescribing any type of an opiate painkiller type medication, a Schedule II, Schedule III drug, or even a controlled substance, depending on what that CDS is, the controlled substance, they may recommend to the patient that they should get a Narcan device, and basically either this type, and we'll show you how that works. It's a syringe-based device, and this is actually the nasal spray. So depending on which one, sometimes with family members, if they have chronic pain, they've had a painful surgery, some oral surgeons still believe it's important to have that available for pain relief for people who have a very low tolerance to pain or a very high sensitivity to pain. They may still prescribe an opiate, codeine. I don't believe Demerol, but they're all out there. There's Percodan, there's Dilaudid, there's Valium actually is not an opiate. There's morphine, there's codeine, all kinds of stuff. Obviously, fentanyl, which is a new and upcoming overdose that's occurring, is definitely a painkiller where that could cause an opiate. So in the state that you're working in, it's very important to know what your state boards are requiring you to do and what to follow. So in New York State, excuse me 1 second, my head's a little too close to the camera, but I wanted to get you these documents. This is the actual program in New York State for dental practices. The medical boards, they have their own procedure and website to go into for medical offices and urgent care centers and so forth. But these are all some of the steps that we talk about, signs of opiate overdose, when to administer it. And in New Jersey, excuse me 1 second, I have to drop down to the floor because I've lost my other document. This is the one for New Jersey, which is through the New Jersey Dental Association, which you can obtain that through the Division of Consumer Affairs, which is currently where the New Jersey Dental Board regulations are. We recommend to all of our clients, both medical and dental, that they should have this attachment and they should have it downloaded into a central computer somewhere in their office, because the steps, according to the state boards, which regulate the administration of the Narcan, have things that they want you to follow. And one of those are that you have to be registered in the state's PMP program, which is the Prescription Monitoring Program. So for anyone who has a license, a DEA number, New Jersey dentists in New Jersey, oral surgeons in New Jersey also have what's called a CDS number, which is basically, a controlled substance number that allows them to write prescriptions for controlled substances. So we recommend that you have that. I'm sure you're probably familiar with your state's prescription monitoring program. Hygienists are supposed to be trained in opiate overdose now. And in New Jersey, they specifically just passed a regulation this past year requiring all registered dental hygienists, RDHs, have at least 1 hour of continuing education, because it is often, if it's an office manager, a practice manager, and they're also a registered dental hygienist, they may be what we call the diplomat, which kind of handles putting the documentation into the prescription monitoring program, the dosage, the frequency, and so forth, and then also monitoring the refilling of those prescriptions. But we recommend everybody take this course. We think it's a great course, even if you're not a clinician. We think it's great for you to know, because Narcan made its way into the hands of the lay public many, many years ago. When I practiced as a New York City paramedic 30 years ago, things were very, very different. Paramedics were the only ones that had the Narcan. They were the only ones that could administer it outside of a hospital setting or a physician's office. But since then, these devices have now gotten into the hands of lay rescuers, which we think it's a great idea. So, if you have a family member that possibly is on some type of a painkiller or has chronic pain, and they are being regulated through a licensed medical provider, they probably are going to recommend that you have a Narcan device, just in case there is an accidental overdose. But the two different types of devices that are out there, this is typically what you see more commonly, which is a nasal spray. This blue and white device is basically just a training unit. So if we have clients that want live training on this, we will actually take an advanced life support mannequin out to our individual clients' offices, and they actually come up and they practice administering a Narcan into the nose or the nostrils, pretending that it's a patient. So depending on the device, this is actually a kit that you put together. This is typically what is found on all basic life support EMT ambulances. All EMTs now are allowed to have Narcan on board their truck. The typical protocol before this was available was that only paramedics or advanced EMTs in some states could administer the Narcan. And it was typically a little glass vial that we would draw up with a syringe. We would take it out, put it into a syringe. We can give it into the skin as an injection, or we can inject it into an IV, IV tubing of an IV that's being run on the patient. But this particular device has 3 parts to it. And basically, when you open it up, it's going to be what we call these Bristojet large dosage syringes. This is the actual vial of Narcan. You're going to pop off the top, and this basically gets screwed in. And as we screw this in, we're going to push this Narcan through this Bristojet device, which that's the liquid Narcan. And then we put what we call the nose atomizer unit on the end. And typically, this is how this looks. So this goes into the nose. We push the Narcan, the liquid, through the syringe all the way to the end of the vial, and we get what's called an aerosol spray or a mist, which is the Narcan that goes into the patient's nose. And the instructions on each of these, this one, and the original packaging, which is the one you probably have in your emergency kit, it's the actual Narcan, which is the manufacturer. I think several pharmaceutical companies make the Narcan, but the original manufacturer, their device is red, and it looks very similar to this. But the instructions are on there to say, well, should you give it all in one nostril, or should you give one in one nostril and another spray in the other? But these are single patient use devices. So once you administer the entire dose, you're done. There's no more left. And the protocol, depending on the state that you're in, they usually say, if we administer a dose of Narcan, we don't see any effects, we don't see any improvement in a patient's cognitive ability, their consciousness level, their respiratory signs and symptoms, which are bad, which is indicating that they are hypoxic. If that isn't improved, within 2 to 5 minutes, we can give another device. The idea is to try to block as much of the drug as we can when the drug is taken into the body. It's basically a blocker. It's an opiate blocker. And it may not work on all substances, especially if we don't know what the patient took. But here's where we see it being more of an issue. It's usually not something because of what you've administered, although in hospitals and general anesthesia, I had a colonoscopy once, and I remember it very clearly, where I swear the anesthesiologist gave me way too much of that stuff. And maybe it's just I was sensitive to it, but I've had colonoscopies before where I've come out with no issue, and I'm glad it's over, and I'm happy, and I'm ready to get back to my life. This one, I was really not alert. I was really lethargic, really loopy. All I wanted to do was to go to sleep. I really wasn't in the right condition to get up and walk out of the practice. And that's what they did. They actually walked me to the door, and they didn't wait to make sure that I had a ride back. My wife was on her way to come pick me up. And I just remember feeling really bad. I did not like that feeling. And all I wanted to do was just pass out and go to sleep. And that stuff, which I don't know, I have to think it was probably, if it wasn't a Versed, maybe it was Propofol, whatever they use when they do colonoscopies or any type of endoscopy procedure to knock you out. That stuff stayed in my system for about 2 days, and I literally was lethargic and dragging my feet. So somehow I was very, very sensitive to it, and I have to think it's probably not hard to overdose somebody when you're pushing it into that IV line before surgery. You could easily push just a little bit too much, but everybody's different, has different sensitivity to certain type of toxins or substances in their body. So I remember that. And then the one I had after that, 5 years later, I told the anesthesiologist what happened. And she said to me, she goes, I know exactly what happened. I know the exact amount to give you, the number of milliliters. I know how much of that fluid that you need. And it was fine. Had no problem. It was perfect. So again, can it happen in a hospital? Sure. Can it happen during an oral surgery? Sure. This is why you have to have it. But where we see it happening more often is when patients come into your office. They come into a medical practice. They'll come in for an exam. They'll come see their physician or an urgent care center for whatever complaint that they have. Or they come to your dental practice and they're on something when they come in. So here's the protocol that we basically follow. So if our patient has any signs of shock, and shock can be high rate of tachycardia, high rate of breathing, very slow, absent breathing, or what we call agonal breathing. Agonal breathing you learn about when we do CPR training. And those are situations where we're looking to think this patient not only is on the drug, but if we give Narcan, that might be a good thing. But what we're not concentrating on is establishing an airway in them and ventilating them and giving them oxygen and using an ambu bag in a medical setting to ventilate. Because if we don't fix the hypoxia, the Narcan may be of no value. We have to get their pulse ox back up. We have to get oxygen to their brain. That's where when someone goes into respiratory failure and respiratory arrest, now we're looking at severe hypoxia. So not in all situations are people prepared to ventilate. Medical, dental, yes, we train them to do that. And in most states, it's mandated you must have an emergency kit. You must have Narcan in that emergency kit. You must have a portable oxygen unit or a crash cart that has an airway kit to establish an airway when they're unresponsive and they don't have a gag reflex, and an oxygen unit to give them medical grade emergency oxygen. Keep in mind that oxygen helps to circulate blood. If we improve their circulation, we might improve delivery of that drug. So again, it's not just the Narcan, it's maintaining their airway and administering oxygen and being prepared to ventilate them. The difference between the two devices, this is typically a 4 milliliter device. This one typically is what is used in EMS. You may also see that in hospitals on their crash cart because it's so simple to administer that even a basic level EMT who does not have a paramedic advanced background can administer it. This is a 2 milligram per milliliter device. We like the 2 milligrams because we think the first dose shouldn't be more than 2, because we need to monitor that patient to see if we've gotten any improvement in him before we give another one. Even with 2 milligrams, if we don't ventilate them, we're not fixing the hypoxia. The 4 milligrams is a little bit higher of a risk, primarily because we're looking at the chance, if they're really hypoxic, then we're going to be looking at a possibility of us not being able to actually fix that hypoxia, and they will go into respiratory failure. We know respiratory failure leads to respiratory arrest and cardiac arrest. So altered mental status, states of confusion, pale diaphoretic skin, unable to follow your commands, improper breathing, pulse oxes. It's required in most states now in medical and dental practices that you must have a portable pulse ox device, even a fingertip device. Any numbers in a pulse ox that are less than 90 is not a good sign. We need to have supplemental oxygen, and we need to be able to get their rate of breathing, because if they're not breathing properly, which is usually at least close to maybe 15 to 20 breaths a minute, we may need to bag them and assist with their breathing that they do have to increase that breathing effort. A pulse ox will be very valuable for you. So you're looking at the number. A number in a pulse ox that they say the range should be anywhere from 92 to 98. However, if a pulse ox is ever in the 80s, that is a clear indication that they are heading into respiratory failure. And regardless that we're giving Narcan, if we're not able to maintain their respiratory functions, they could very well die and we may lose them. So we in EMS have all of that equipment. Police officers, sometimes they have it. Fire departments typically have it on their truck if they show up on an EMS call. EMTs are trained to ventilate, to bag a patient with an ambu bag. But this equipment that we're talking about is also important for you to have in your practice, because if a patient were to go down, or you have what we call a code, you need to make sure you have this equipment and the training to use it. And that's primarily what our focus is at Corporate Medical Emergency, is to come in, look at your office, look at your practice, make sure you're not missing any essential pieces of equipment or certain emergency medications, train you on when to give that medication. So those are typically the times that you could give Narcan. But the theory with Narcan is that if you did give Narcan to someone who did not need it, The worst thing that probably will happen, it will probably cause vomiting. It may cause some unwanted GI side effects, nausea, stomach cramps, and the patient's not going to be very happy. They're going to come out of it pretty angry that you gave them the Narcan. So you want to understand that Narcan will only probably produce those unsighted or unwanted side effects, but we really don't need to give it unless it's a clear sign that they're hypoxic by having a pulse ox, mental status, pale diaphoretic, pale skin, and improper breathing. These are usually the times that Narcan is warranted. And getting a good history on our patient is also very important. Patients come into your practice, your office for an appointment. It's really important we understand the medications that they're on. We know today that there's a lot more benzodiazepine overdoses because people are on antidepressants and they're on benzodiazepine. Namely, there's Lexapro, there's Prozac, and certainly, a lot of these that are benzodiazepine based, unfortunately, they actually can depress somebody's breathing. So even if they had overdosed on a non-narcotic and you suspect it, if they meet the criteria, we're going to give the Narcan. And that is basically a Good Samaritan law. Family members, they can now have Narcan in the home if they have a family member who is on a chronic pain management or they've had a painful surgery. I had knee surgery 30 years ago, and I remember being given Vicodin for the pain. And back in those days, they filled the bottles, and I had access to as much Vicodin as I wanted, which I could have more than likely killed myself and become addicted to the Vicodin. But now people are on a lot more things. And when prescriptions for these are being written, we all know that you can't call that prescription in. It has to be walked in by the patient, and the patient has to go and pick that up and get it filled in person. And any pharmacy that someone, a licensed healthcare provider that either has a CDS number, in New Jersey they call them CDS numbers, which is the ability to write a controlled substance, DEA numbers, obviously we all know what those are, to be able to administer opiate medications and prescriptions. These patients have to come in and they have to get it filled in person. And if anyone tried to call it in, the pharmacy should be telling them we are not allowed to fill that over the phone. So those days of overfilling the bottles is typically not the case now, which they believe can prevent further opiates or even a misuse of taking the medication, because we still have to hope that the patient's going to follow our instructions when we give them specific instructions on taking the medication, how to take it, how frequent, and what those side effects are. So both of the PMPs, the New Jersey and the state of New York PMP, you want to make sure that you have that downloaded in your computer. They're usually PDFs. They will give you the instructions and the steps to follow in writing the prescription, which includes evaluating the patient, determining if there are any red flags or any signs to make you possibly suspect that they're just looking to get that prescription filled. There's nothing really physically wrong with them, but that's really up to the prescriber because everybody does have a different tolerance level of pain. And typically oral surgery, sometimes people have pain afterwards. But what you'll find is constant studies are being administered out there and being sought after about how we might be able to regulate patients' pain with a non-opiate based product, which would be your anti-inflammatories, the non-steroid or steroidal anti-inflammatories. Your higher doses of Tylenol, Advil, Motrin, sodium naproxen, which is Aleve, things like this are actually becoming very effective, and we're starting to see that pain management level is equal or about the same. It may not be 100% pain-free, but it's tolerable and it's manageable, and it prevents that patient from having to have the risk of taking opiates and becoming an addict or having an overdose. So the Narcan will always be administered in those situations. What we do want you to do is to make sure before you give the Narcan, whether we're giving this device or this device, and Narcan may still be manufactured in a glass vial. When I was a paramedic 30 years ago in the New York City EMS system, that's what we had. We didn't have the technology for these devices. They were not in the hands of lay rescuers. They were not in the hands of family members. They were not in the hands of basic level EMTs, and they were not in the hands of dentists and dental practices. Now they are. So it is a mandate that you must have the Narcan in your medical emergency kit. And when we come out to do your inspections and do your walkthrough inspections and audits in your individual practices and offices, we look for that. We have your medical emergency kit brought out. We look at your emergency equipment. If anything is expired, it must be replaced. Or if you don't have the Narcan, you have to have it. Every state now requires it, at least in a dental setting. So you typically would have one or two of these types of devices. We haven't really seen this one. I've been in a couple of oral surgery practices, and I've seen this, but typically most dental offices will have the nasal spray device like this. So if we're giving Narcan, before we give Narcan, we need to always dial 911. It helps protect us when we call the professionals or the experts. 911, EMTs and paramedics will make the determination whether that patient should go to a hospital. Where I see that we're not, unfortunately, helping these patients with this is when a patient comes out of an overdose, who maybe after we given them Narcan and other things, if they're alert and oriented, they know where they are. They can follow our commands and answer our questions. By law, they do not have to be transported. We cannot transport a patient against their wishes if they are of sound clinical judgment or sound clinical mind to make a decision regarding their health care. And this person may very well go out and get high again and kind of do the same thing they did before. So it happens to be one of those things where we just do the best that we can. We're hoping that we can save lives. Maybe it's the early stages of that overdose because of the hypoxia threat and because of the hypoxia damage that Narcan itself will not correct. So that's basically the Narcan program, calling 911, documenting it, filling out an incident report form that needs to be documented in the patient's chart so that if that resurfaces down the road, they want to know if you gave Narcan and what the outcome was. Having EMS there to help you document and witness that is also very important. The other issue is, as we're setting up the Narcan device, depending on which device it is, someone is hopefully administering the Narcan, and we are getting ready to get an airway on that patient. Because if the patient is unresponsive, most of us know from basic CPR training, the first thing that you're taught is that when a patient is unconscious, the tongue, the anatomical portion of the tongue, will come down and block the trachea and block their airway. And if we don't have an airway and we're not ventilating him as we're giving that Narcan because of the hypoxia, as we said before, the Narcan may not be enough on them. And the higher doses that we give, whether it's 4 milligrams, 2 milligrams, we have to repeat it, give them another one. We need to have oxygen pumping into them, especially if their pulse ox is very low. So all of that needs to be done while the Narcan is getting administered. And finally, they need to be put on their side when we give the Narcan. Because of the threat of vomiting and stomach contents and aspiration, getting them on their side, giving the Narcan that way is going to be a lot safer in the fact that they do vomit. And so that you hopefully would have suction available and prevent aspiration. And if that were to happen, maybe by calling 911 when you begin this whole treatment regimen, they're there. They're there to help you, and they're there to deal with it with their portable suction and clearing the airway out. So we think you should check with each of your state's medical, dental boards, prescription monitoring program. Make sure that you're registered. I'm sure that you are. I would have to think that in order for a medical or a dental practice to be licensed to where they do have the ability to write prescriptions for certain types of things, they must be registered in the prescription monitoring program, because all the information that you or your hygienist is putting into the database is information that the pharmacy is going to be able to access, because they have to have a P&P program as well to document the dosages. You know, where the red flags could be for addiction would be if they want more of the drug, there's more repetitive requests to get it refilled, and we start to see those red flags and those signs. I've had some doctors and dentists in our company in 22 years that we've been providing this program and our other medical emergency training programs. They tell me really wild stories where people can just walk right in off the street and throw a couple of bucks to the doc and say, "Hey doc, do me a favor, can you fill this for me?" And it turns out that they actually are already in the prescription monitoring program, and they were having trouble getting that drug refilled. And so now they're doing what we call prescription shopping. They're going to go door to door until they find someone who might be willing to fill it. So again, we see more people coming in on things than we do people improperly administering certain medications or even in surgery. Again, patient can be very, very, sensitive to certain types of anesthesia, and so they always have to have their reversal agents on board. Flamazidil is another one that's been around for a long time. It's an older drug. You typically see that in general anesthesia, surgical operations, surgical procedures, but it does the same thing that Narcan will do. So we actually have a lot of good resources for any of you. As always, with any of our online programs or virtual programs that we're doing for you, we encourage you to reach out to us. We have access to the New Jersey's monitoring program for the prescription monitoring. We have the one for New York State. Any states where you may be developing practices and opening new practices, we'll be able to get that information for you. And we have a really good resource, which is a nice handout, basically for anyone who doesn't understand what Narcan does or what the effects of the Narcan are. And for people that are non-clinical, that don't have a medical background, that go to get these in the pharmacies when they have family members that might be on medications, are typically educated by that prescriber or the pharmacist, and usually they'll give them a fact sheet. They'll give them information to understand what Narcan is. And every state now allows anybody to give it, based on the fact that we have a suspected overdose. So, but look at the bigger picture. Make sure you have these other medical emergency equipment items. Very, very valuable to have. It's not just administering the Narcan, it's airway, keeping the airway clear. It's ventilating them, knowing what their pulse ox is. Remember 84. 84 is a number that I always like to tell people because I remember it very clearly, like when I was in paramedic school 30 some years ago. We were taught as future paramedics that anytime a patient's pulse ox drops into the 80s and it as at 84, at 84%, it continually drops rapidly. And 84 is impending respiratory failure if they're not already in failure. And the Narcan's not going to correct that. It will block the drug, we hope, from taking effect, but it may not clear up the hypoxia. So in New York, the current dental boards and the medical boards for medical professionals are a little different, but dentists in New Jersey and New York. New Jersey requires 1 hour of approved continuing education credits, and New York requires 3 hours. So either way, the course that we're doing here will qualify for 3 hours of approved continuing education. You have to have proof of that if your dental board requires that you show proof that you've had that when it comes time to renewing your license. And typically, hygienists, registered dental hygienists, RDHs, the doctors, the dentists, oral surgeons, so forth, they have to have that proof, just like they have to have proof that they're currently up to date with their basic life support, CPR, healthcare provider certifications, and or advanced cardiac life support, ACLS, if they're doing any type of general anesthesia. Some states with IV sedation, even conscious sedation, may require ACLS certification. So we handle all of that for you. We will be monitoring your learning management system. So for all of you that do complete this course, it will be checked off in the learning management system. We're monitoring that bi-weekly. Every 2 weeks, we'll go into your LMS, check to see if you've completed this course. It could very well be a corporate-wide mandate, even for all staff, maybe even non-clinical people. So with all of our programs and protocols that we teach, we always mention and stress again how important it is that you do check with your corporate location, your corporate policies, your human resources to find out if you're a non-clinical employee or staff member, they may still want you to sit for this training because you could still be of value in a medical emergency in your practice, even if it's just getting the box of Narcan out and opening it and putting the kit together, which is very simple to do. So we'll be forwarding your certifications to you. If there's ever an issue with a course or any issues that you need to reach me, I'm actually the owner of the company. Most of you know I'm also the director of all of the compliance for dental service organizations and medical practices that have many locations. I'm in charge of all that compliance. So feel free to reach out to me at any time if there's a problem with the course or whatnot. So this completes the opiate. There really is no need to be doing 3 hours of lecture. But because we're nationally approved and our programs are approved through the Academy of General Dentistry, we can qualify for the 3 hours of the continuing education credit for those of you in New York. Obviously in New Jersey, it's at least 1 hour, but we'll give you the 3 hours. So, all righty. So, and just go back and check, make sure the vial of your Narcan is up to date. We never ever want to try to administer an expired medication to a patient in dental or medical because we know that increases liability and it can be sought out later if a penalty was assessed. And that's our job, is to prevent that from happening. We actually assume that liability for you by I don't want to say enforcing our training, but recommending that you're doing our training, recommending that you're following our policies and our program, because there should be no liability. And again, if you're a non-clinical rescuer or non-clinical staff, having you trained to give Narcan could be a good thing. And that's why we want you to check with your HR department to see if they want you to take this online course. Alrighty, so make sure you have the equipment, the Narcan. If any updates come up, currently there are no new updates regarding the Narcan administration and opiate overdose. We're kind of the experts with that. We're monitoring the regulations constantly. We know things are ever changing and we're always having new things that come out. So we'll be the ones to make you aware of it. And just check to make sure and see which Narcan device that you have, understand how to administer it, and you should be able to go in and play this video as many times as you want just to refresh yourself on how to use a Narcan device, because that one administration could save that person's life if we suspect that they have an overdose. So, Um, any questions, please let me know. I thank you for the opportunity again to do yet another training program for you. I do hope that you find this educational and valuable. And for now, we're done. And I wish you all well, and we will see you again in the future. Thanks so much. And everybody, continue to stay safe, please.